Thank you. So I will focus a little bit on the mandate of WOAH and how we are using surveillance and information from our members and the potential for Earth observation in this regard. So we start with the mandate of WOAH. We actually this year celebrating our 100 years of existence. And since then, we have the mandate to ensure animal health and welfare. And for that, we collect information from our members through, we call it WOAHs. So it's information system for animal health. And our members are committed to report certain diseases that I will explain later through this system. But 20 years ago, because of the accelerating base of emerging infectious diseases, but also for the proliferation of big data and internet, our members, they say the official notification and reporting is not enough. We need to use other sources, unofficial sources from the media, from any reports out there, and use it to help us to understand better the risk and how to manage it. And for that, we have the mandate now to conduct epidemic intelligence using other data sources than official notification. For the support on the surveillance, we rely on our standards, be it for terrestrial codes or recently the aquatic codes. And we use the surveillance as a tool to help us to monitor the disease trend, to help us to facilitate the control of infection or infestation, but to use it also for risk analysis and risk management for animal health or for public health purposes. And also to justify certain prevention measures or sanitary measures taken by our members, and also to provide assurance for our trading partners in case of issues with the trade on animal health or on animals or their products. In addition to our standards, we have, of course, a lot of guidelines and recommendations from our working groups. We have training portals and e-learning courses. And we have a comprehensive network of collaborating centers and reference labs to support this work. I provided here in this slide examples of 3 projects that we are currently working on related to surveillance. The first one in West Africa about surveillance of viral hemorrhagic fever. But this project will soon be expanded to other countries in the regions. The second one is also for the Africa focus. It's about how to build the resilience against biological threats with the health security perspective in mind. And the third one, which we collaborate with the Italian Institute about enhancing risk-based surveillance for vector-borne diseases in 6 countries in North Africa. For our standards, this is where the specific chapters come in for the mandate on the surveillance for the terrestrial and for the aquatic. We also have projects to support countries adopt their legislations so to make this notification of the listed diseases applicable in the country and backed by a legal framework. For the diseases, we have 117 in total. Mostly they are terrestrial, but we have 29 diseases in aquatic animals that they have to be reported to WOAH. But you can see in this slide that the reporting is not optimal. We have only 33% of countries reporting on majority of the diseases, but less so for the aquatics. So we have a lot of room of improvement here. And this is from the implementation of our disease surveillance and how it varies between regions. but also how it varies between diseases. For the region, you can see here in the slide that Africa is the least region to report the diseases consistently, and less so for aquatic diseases. And on the other side, you can see the difference between certain diseases where the highest reporting will be on high pathogenic avian influenza, but less so on other diseases. And here also we try to put the lab capacity and the surveillance system, if it's in place or not, to understand these differences. In total, we have 35% only of our members that they have the overall sufficient capacity in terms of surveillance in animal health. And here we listed the 6 critical competencies that each country should have to be able to be certified that their surveillance system is up to the standards. And you can see here that the lab quality assurance is the lowest one that's of need of attention. Now, for the early warning system that we have, we collect this notification from our members, and then we have the intelligence from open sources, and then we get alert from our expert, from the collaboration center, from reference labs. We triangulate all of this to come up with risk assessment. Sometimes we do it jointly with the WHO or FAO, depends on the disease that we are tackling. And importantly, we do some forecasting, and we share this information back to our members through public, through the official channels, but we also share it with the public through risk communication and key messages. And importantly, we use it to inform our preparedness and response actions. Now, this example of the glues that Madhur has highlighted, it's a global disease intelligence and early warning system where 3 organizations, and now hopefully UNEP will join us, and will be a quadripartite projects where we share the information between the agencies and do joint risk assessment and deliver jointly early warning messages. And this is one of the examples that we did it together during COVID-19 and the introduction and the spread of SARS-CoV-2 in the fair farming systems. And we try to map this and produce the report for risk communication and risk management recommendations. We do also a lot of risk analysis workshop in terms of wildlife. And we see here a lot of potential of Earth observation because it's very much linked to biodiversity loss and habitat fragmentation and climate change as well. The last example I would like to highlight, it's the project that we are doing now in North Africa to use Earth observation to inform our vector-borne diseases. And we started this work with the fund from the German Ministry of Economic Development, BMZ, but we partnered with our colleagues in ISIS to do the technical works. And basically just to highlight or define the ecoregions according to the climate or environmental variables in these countries, and then understand how these variables could affect the introduction or the spread of vector-borne diseases in these countries, and what can we do to monitor them. And we selected the disease as Rift Valley fever there. Next step, we will involve the relevant authority in the validation of this ecoregion results. We will help them to integrate this use of Earth observation into their national surveillance system. And then we will test this approach in other regions. We have a plan to expand this work to 3 countries in East Africa, also on Rift Valley fever, but also we have a plan to expand it to Central Europe and some of the Balkan countries, with the West Nile viruses. So, in conclusion, we see a lot of potential to collaborate together on prevention and control.